Okay, transferring the patient from the bed to stretcher. If your patient cannot sit, or the patient is very weak and cannot use the wheelchair, we have another option. We have the stretcher. Especially in the hospital, if you're going to transport the patient into other section like operating room or other section, use this one. But in SQU, the bed itself will be used to transport the patient.
Yeah,
Don't
they
worry.
move the bed itself to OT.
Yes. But in some other hospitals, they're still using the
No,
stretcher.
but for OPDs and all,
Yeah.
the beds cannot go inside that. So
Mm.
they're still using that.
Okay, there are two ways on how you can transfer the patients from the bed to stretcher. You can either with the use of butt slide, or you can use it with the use of turnship only. Okay, now, if you're going to transfer the patient from bed to stretcher, the first thing that you're going to do is to make sure that there are no chewings in the bed or anything that will prevent you from moving the patient freely. You need to check any tubes or any wires or anything on the bed. Okay, now, since you're going to transfer the patient on the stretcher, you need to decide which bed should be higher, the stretcher or the bed. Just consider the gravity you're going to transfer the patient to the stretcher. If you're going to do that, the bed should be higher than the stretcher, correct? We will first use the turn sheet before this one. Or we'll just use that one. Hmm? Three. Okay, now I'm going to elevate the bed higher than the stretcher because I'm going to move the patient to here. This is higher already. Okay? And make sure you have the turn sheet here. And make sure to put the stretcher parallel to the bed. And make sure it is locked. Where's the lock? There's a lock here. There's a lock here. It will not move. So this is very important. This procedure requires more than one nurse. You cannot do it by yourself. At least 3 nurses should be there. Okay? You can have 2 nurses on the other side and 1 nurse here if it is possible. Okay? Now, the preparation of your patient is the same with what we've done earlier. Hand over the chest, foot over 1 feet over the other, and we can ask our patient to flex the knee, the neck, if we want to transfer the patient. Again, if there is a surgical involvement, you need to ask for another nurse. This is the heaviest part. Okay? Reach the turn sheet. Now, in the book it says if you have additional linen, you can actually fill in this one. If you have additional linen. But if not, you can move with the use of turn sheet. I think I need a help. Yeah. Tomorrow, or maybe with my group, maybe we can ask some students. They can do it by group. They can do it individually. Okay? 1 foot forward, the same process. On the opposite side, 1 foot forward. And then, fold the turn sheet as nearest to the patient as possible. And then at the count of 1, 2, 3, we're going to pull this turn sheet to our side.
If it is normal person, they know to keep their head by themselves. No mannequin, no. They should remember to,
Okay.
otherwise the head will go like that.
Repeating. 1, 2, 3. Oh, sorry. But in the actual patient, it will not happen.
He will keep the head like this.
Okay? The same process. If you want to put back the patients on the bed, you need to lower than the bed at this time.
Real exercise.
I think I will go to the other side. You stay here, ma'am. Yeah, she was alone. Okay. There are some instances where you need to put your tomorrow you will do. Because you cannot do this tomorrow. It's difficult on your back. Okay. The same process, we will count 1, 2, 3. Okay. But this procedure is easy if you have butt slide. Okay, at this point, we're going to use the pat slide. Okay? Increase the height of the bed. Yeah. Oh my god. Okay? You can actually insert this one under, actually the easiest one. So that you just need to pull this one. You can either you can put this one in here so that no need to lift, you just need to slide. Or you can put this one entirely on the back and pull this one to this side. It's fine as also.
The head we should be careful. The head is supposed to be like this. Your head should be like this.
You just put first this one under so that we will
Fully
see.
under
Yes.
the
Yes.
Yes.
Okay.
Like this.
Yes. Okay, you just need to pull this one.
Oh, it's better.
1, 2, 3. See?
Easy.
Easy. The same process when you transfer the patient to that side. Use the
Every ward has this pat slide. Okay, so they are using this only in the hospital. So even if you don't do the first method, do this. Because book says all methods, no, we are telling you how
The
to
manual,
use
the
it.
last one. Last is the manual, without the turn sheet and without the pat slide. Okay, ma'am, go. Let us- Oh.
The sliding is easy.
So at this point, manually, we do not have the turn sheet, we do not have the pat slide, we do it manually. So at this point, we're going to position the stretcher correctly. And you need at least 3 persons to help you.
Right hand.
Yeah, here. Okay. 3 persons at the same side, as much as possible of the same height. Okay? The first person should handle the head and shoulder. The second person, the hip and the waist. And the third person on the lower and upper legs. Like this. Okay? Insert both of your hands and then count 1, 2, 3 and then 1, 2, 3. And then Shweya, in unison, move to this side. I don't know if they're still doing this in the hospital.
No, I don't think. Very risky.
Maybe in the community.
Yeah.
Community hospital.
What take a risk?
And then make sure to side rolls up. Actually, the head first. Okay?
She knows. Covering.
And then you cover your patient with and that ends the procedure.
And it's used.
It's dangerous.
Yeah, risky.
Yeah.
But good to show them so you don't
Yes,
know when
yes.
they need it.
Maybe you can do it by group of students.
All 4 students.
It's like what we did by 4 students or by 3 students.
Involve the students. First 4 they learn from that and